Hello OCFS and welcome to News Update. The human swine flu outbreak continues to grow in the United States and internationally, causing many of the children, families, providers, and agencies served by the Office of Children and Family Services to worry. The best way to manage that anxiety is to share with each of you what we have learned so far from the New York State Department of Health, which has actually been providing OCFS with regular updates ever since Governor David Paterson announced on Sunday that he had activated the state's health emergency preparedness plan and put our state into high alert to quickly identify and respond to any cases of the swine flu. In New York City, 45 cases of swine flu have been confirmed by laboratory testing, and 2 schools in central Queens have even been closed down. These are the St. Francis Preparatory School and PS 177. However, according to both state and city health departments, all of these confirmed cases in New York have been mild. All the patients have recovered or are recovering. According to health department officials, we are still in flu season, and the human swine flu is the predominant form of influenza at present. At this time, state and local health departments have advised us that children can continue to go to school and childcare as long as they are not sick and their families do not think they have flu symptoms. Flu symptoms include a fever of over 100 degrees Fahrenheit, a cough, sore throat, and a runny or stuffy nose. Additional symptoms that may be experienced with swine flu include muscle pain, fatigue, and sometimes vomiting or diarrhea. If a child in your care has flu symptoms, please contact the child's family immediately and ask that that child be removed from your care. If you have flu symptoms, stay home. Do not go to school, childcare, or work, and don't go anywhere where you could expose other people to flu germs, including buses or subways, the mall, or even sporting events. Knowing that we are still in flu season, it is important to exercise basic precautions to protect yourself and others from the spread of infection, and to teach those precautions to children for whom you're responsible for at home or at work. Wash your hands often with soap and water. 20 seconds, by the way, is ideal. It's about as long as it takes to sing the happy birthday song to yourself twice. And despite any regulatory provisions to the contrary, you may use hand sanitizer. Gels, rubs, and hand wipes all do work well as long as they contain at least 60% alcohol. Hand wipes must be disposed of properly, by the way, and always read and follow label instructions when you're using hand sanitizer. Keep your hands also away from your face and avoid touching your mouth, nose, or eyes. Cover your coughs and sneezes with tissues or by coughing into the inside of your elbow. If you don't have a tissue handy, cough or sneeze into your sleeve and not in your hands. This information, by the way, is available in 14 languages. These include Spanish, Mandarin Chinese, Russian, and Creole. These can all be found on the New York City Health Department's website at the address that you are now seeing on your screen. If you serve children and families with limited English proficiency, please print out and provide them with the appropriate language fact sheets. If we all practice good hygiene, health officials do believe we can limit the spread of the swine flu. However, as a provider, you need to be prepared for possible school and child care closings if this flu virus does continue to spread. Now, to get the latest information on this flu outbreak, you can call the state's 24-hour toll-free telephone hotline. That number is 1-800-808-1987. Or you can also visit our New York State Health Department's website or the Centers for Disease Control's website. You're seeing both of those addresses on your screen right now. Thanks for stopping by, and do stay healthy.